Determinants of health. The range of personal, social, economic, and environmental factors that influence health status are known as determinants of health. Determinants of health fall under several broad categories. Policy-making related factors, social factors, health services related factors, individual behavior related factors, biology and genetics related factors. It is the interrelationships among these factors that determine individual and population health. Because of this, interventions that target multiple determinants of health are most likely to be effective. Determinants of health reach beyond the boundaries of traditional health care and public health sectors. Sectors such as education, housing, transportation, agriculture, and environment can be important allies in improving population health. Policy-making related factors. Policies at the local, state, and federal level affect individual and population health. Increasing taxes on tobacco sales, for example, can improve population health by reducing the number of people using tobacco products. Social factors. Social determinants of health reflect the social factors and physical conditions of the environment in which people are born, live, learn, play, work, and age. Also known as social and physical determinants of health, they impact a wide range of health, functioning, and quality of life outcomes. Examples of social determinants include availability of resources to meet daily needs, such as educational and job opportunities, living wages, or healthful foods. Social norms and attitudes, such as discrimination. Exposure to crime, violence, and social disorder, such as the presence of trash. Social support and social interactions. Exposure to mass media and emerging technologies, such as the internet or cell phones. Socioeconomic conditions, such as concentrated poverty. Quality schools. Transportation options. Public safety. Residential segregation. Examples of physical determinants include natural environment, such as plants, weather, or climate change. Built environment, such as buildings or transportation. Work sites, schools, and recreational settings. Housing, homes, and neighborhoods. Exposure to toxic substances and other physical hazards. Physical barriers, especially for people with disabilities. Aesthetic elements, such as good lighting, trees, or benches. Poor health outcomes are often made worse by the interaction between individuals and their social and physical environment. Health services related factors. Both access to health services and the quality of health services can impact health. Healthy People 2020 directly addresses access to health services as a topic area and incorporates quality of health services throughout a number of topic areas. Lack of access or limited access to health services greatly impacts an individual's health status. For example, when individuals do not have health insurance, they are less likely to participate in preventive care and are more likely to delay medical treatment. Barriers to accessing health services include lack of availability of services, high cost, lack of insurance coverage, limited language access. These barriers to accessing health services lead to unmet health needs, delays in receiving appropriate care, inability to get preventive services, hospitalizations that could have been prevented. Individual behavior related factors. Individual behavior also plays a role in health outcomes. For example, if an individual quits smoking, his or her risk of developing heart disease is greatly reduced. Many public health and healthcare interventions focus on changing individual behaviors such as substance abuse, diet, and physical activity. Positive changes in individual behavior can reduce the rates of chronic disease in this country. Examples of individual behavior determinants of health include diet, physical activity, alcohol, cigarette, and other drug use, hand washing. Biology and genetics. Some biological and genetic factors affect specific populations more than others. For example, older adults are biologically prone to being in poorer health than adolescents due to the physical and cognitive effects of aging. Sickle cell disease is a common example of a genetic determinant of health. Sickle cell is a condition that people inherit when both parents carry the gene for sickle cell. The gene is most common in people with ancestors from West African countries, Mediterranean countries, South or Central American countries, Caribbean islands, India, and Saudi Arabia. Examples of biological and genetic social determinants of health include age, sex, HIV status, inherited conditions such as sickle cell anemia, hemophilia, and cystic fibrosis, family history of heart disease,